I was in quarantine, which is a very scary process because you can't leave your room. Hello everyone, my name is Stephanie, aka the Blonde MD, and welcome to my channel. I am a newly practicing internal medicine physician in Canada. I've been wanting to start this channel for quite a long time. Whether it was going through medical school, getting into residency, and then going through residency itself, then my licensing exams, and then finally practicing as a staff, the timing at that time just wasn't right. Fast forward to 2020, and we're literally going through a global pandemic. And I've had a lot of time to think as I've been in my four walls, quarantining myself and waiting for my own test, that I thought that now is as good of time as any to start this channel. I want this channel to be a place for you to learn about health, wellness, medicine, as well as tips for you and your family to thrive in this journey we call life. So let's get started. Working on the front line, I'm exposed to patients all the time, and I happen to develop certain symptoms that were quite concerning for the virus. I developed a sore throat, a bit of a dry cough, as well as some sweats and chills overnight, which really did concern me. I wasn't sure what my temperature was because, unfortunately, I don't have a thermometer, and I'm pretty sure a lot of people don't actually own one. However, maybe they do now because I really wasn't able to find one at any pharmacy or store nearby my house. I couldn't even find any online to ship to my house to be able to take my temperature in that time. So I wasn't really sure about fever. But I did describe these symptoms to my colleagues at work as well as to my public health region to kind of see where I go from there. Because honestly, I haven't traveled. And that was one of the #1 criteria at the time when they were testing. So after talking with public health, it was decided that since I have so much exposure with patients who I'm not really sure where they've been or their family, I would be tested. And I was quite scared when this was happening because honestly, I was afraid about the people I had been exposed to, my patients, my own family members. So it was quite a bit of an anxiety-provoking time. But I went to one of those screening centers that they had just recently opened, and I was basically walking through the door. Everyone was covered up in masks and face shields and gowns, and I was there with my little mask kind of walking through and seeing colleagues that I actually know and work with ready to speak to me and decide on whether or not I would even need the test at that time. So I had my vitals taken. Vitals included blood pressure, heart rate, my oxygen saturation, so basically this little thing they put on your finger to see how much oxygen is circulating in your body, and they also took my temperature, which thankfully at that time I did not have a fever. But it was decided that given my role and given my exposure to so many people that I would be tested. So the nurse comes out with this swab, which is basically a nasal swab that they put right up your nostril. It's quite long because there's actually quite a bit of room up your nose into your nasal cavity. And they go up there, they take a bit of sample of the mucus up there and they send that for testing. So after I had my test, I was basically told to go home, isolate myself, and really not expose myself to the other people living in my house, obviously, until the results came in. So I did that. I went home. I happened to be living with other people, so I was really kind of quarantined to the four walls of my bedroom and my bathroom, and thankfully, people provided me with food. I wasn't feeling well, obviously, so I stayed in bed. I did a lot of resting and getting that sleep that I hadn't had for days because sometimes working in the hospital, it's quite strenuous and quite hard. So I took that time to really rest and to hope my symptoms would improve. After, when I actually did start to feel a little better, I would just spend a lot of time on my computer watching movies, catching up on shows and series that I really hadn't had the time to catch up on. During that time, I also was able to talk with friends and family. And I think that's so important, especially during this self-isolation time and social distancing or person distancing. Thankfully, we have the technology from iPhones and computers to be able to Skype and FaceTime with our friends and family. And I think that really was able to keep me grounded during that time because it can be a very lonely time. And I'm sure many of you have had to go through this quarantine yourselves. So fast forward a few days, and honestly, I was going a little bit out of my mind, waiting for my test, and sometimes giving in to my own anxiety because I wasn't sure if I did have these symptoms, who was I in contact with, who had I exposed. Luckily, I did get my result back, and it was found to be negative. And I never felt so much relief, but also the realization that some people don't get a negative result and they're also going through more symptoms than me at that time, and it made me think a lot about the rest of the world and hopefully that I can get back to my job to help them feel better and to make a difference too. I'll be going back to work and being on the front lines and really helping fight this thing, but what can you do at home? And the first thing is staying home. By staying home, you really help by reducing the amount of virus that's out there in the community and also protecting yourself and your family and the people around you. The next thing that's obviously very important and maybe going out of style, but wash your hands. It is very important to wash them with soap and water or with an alcohol-based hand sanitizer for at least 20 seconds, and really to get in between your fingers, in between your nails, because there's a lot of bacteria there, your thumbs, everything. So wash your hands and wash them frequently. We don't realize the things that we touch every single day. Our cell phones, our car keys, the doorknobs, these are surfaces that either need to be cleaned after you use them or you need to wash your hands after you touch them. Another important tip is obviously, again, one that we've been hearing quite frequently on the news is do not touch your face. That can be so hard. Everyone touches their face or your hair, and that can be a problem for anyone with long hair or just people who like to touch their hair. When you're actually thinking about it, you can see how frequently you actually touch your face or your hair. And it's very important that at this time especially is to avoid that. Or if you do, make sure you wash your hands right afterwards. So where do we go from here? First, don't panic. You may be experiencing symptoms similar to what I experienced, and they can be in keeping with many different viruses or the common flu, which is likely what I had. If you're feeling unwell, first you should separate yourself from the people around you. Go home, talk to your healthcare provider over the phone, or they may advise you to call your public health department who may give you the next steps to see whether or not you should be tested. A lot of the times these symptoms are in keeping with the common cold or the common flu, but it's important that we take the safety precautions to separate ourselves from the people around us in order to go forward with that. Secondly, take care of yourself. Make sure you're getting enough fluids, enough sleep, eating well, and stay positive. In a time like this, we don't want anything else to affect our immune systems. So taking the proper precautions to keep yourself healthy during this time is going to help you in the long run. Thank you so much for watching and for listening to my experience going through quarantine. If you've had any experience yourself, please comment down below because I'd love to hear about them. And be sure to like, subscribe, and give this video a big thumbs up, and I'll see you on the next one. Everyone, stay safe.